Good day, everyone. You are welcome to my YouTube channel, Everything Medical. In today's video, we shall be appreciating the sacrum, which is being formed by the 5-fused sacral vertebra. If you are coming across to my channel in your first time, remember to subscribe, like, comment, and also share a video so that other students will see it and benefit from our channel. Now, let's proceed. The sacrum, which is being formed by the fused 5 sacral bone, is a distinguishing vertebra. It is quite different from other vertebrae, such as from the cervical, the thoracic, and the lumbar vertebra. The sacrum is a large fused bony structure that is located at the terminal end of the vertebral bone. It is said to form the posterior aspect or the posterior boundary of the pelvis, right? Now, let's discuss the features of this bone. Because that this bone is quite different from other vertebrae in the sense that the features are so unique. Other vertebrae are not fused. They are only being articulated by the intervening intervertebral discs. That is the cervical vertebra, the thoracic vertebra, and the lumbar vertebra. We have to also understand that the intervening intervertebral disc does not exist between the first and the second vertebra, that is on the cervical vertebra, the atlas and the axis. They don't have any intervening intervertebral disc because it lacks vertebral body, particularly the atlas. Now, this bone, the 5 sacral vertebra, fuses. It fuses, but it does not fuse at birth. It does not fuse at birth, right? Now, there is an existence of that cartilaginous type of a joint, which is the intervening intervertebral disc, when a person is being given birth to. But as time goes, as the person ages, on 20 years of the person's age, the intervening intervertebral disc will begin to fuse together, thereby creating a transverse ridge or a transverse line. You can see it here. This is the S1, the S2, S3, S4, and S5. That means we have what we call the four vertebral ridge, or the 4 transverse ridge per se. 1, 2, 3, 4. So these are the 4 transverse ridge, which would have been the intervening intervertebral disc. But as person's ages, on 20 years, it fuses, right? Because this bone mainly bear the weight of the body. All the weight from the cervical vertebra, the thoracic, and the lumbar usually rest on this bony structure, to tell you that it plays a compassionate role in weight bearing of the body. So that means adult sacrum does not have any intervening intervertebral disc because it is usually being fused, right? Look at it here. This is the transverse ridge, this is a transverse ridge, this is a transverse ridge, and this is a transverse ridge, which fuses all the 5 sacral vertebra. Now, let's quickly discuss the features. It has the base. This is the base. It has the apex. It has 4 surfaces. This is the anterior surface or the ventral surface, which can be called the pelvic surface because it faces the pelvic bone. While this is the posterior surface or the dorsal surface. It is coaxed and rugged, right? Now, this is the articular surface. We call it the anterolateral surface, which made an articulation with the surface of the ilium, right? Now, let's start with the base. This is the lumbar vertebra. This is how we usually articulate. You can see it articulation, right? You can see how it usually articulate on the body. This is how it articulates. There is a joint here. There is a joint here called intervening intervertebral disc, which usually articulates the fifth lumbar vertebra and the base of the sacrum, right? That means there's no intervening intervertebral disc in all these places because here has been fused already. So the intervening intervertebral disc, which is that joint, exists on the base of the sacrum and also the intervening and also the lumbar vertebra, right? So the base of the sacrum provides site of articulation with the lumbar vertebra through its intervening intervertebral disc. I've articulated it, and I believe you saw how I did it. Now, this is how it goes here. That joint is a cartilaginous type of a joint, which usually articulates the lumbar vertebra, particularly the fifth lumbar vertebra and the base of the sacrum. Now, here is the apex. The apex is formed by the sacral conus. The sacral conus forms the apex because the sacral conus usually articulate with the coccygeal conus through its superior articulating process, right? So that is how it works because the coccyx found its articulation here, right? So that is how it works. The next one is the lateral articulating surface, which is the anterolateral surface. Now, this surface, two of them laterally resembles the external ear. That is the ear pinna. You can see it. It resembles something like external ear, which is the ear pinna. This surface, which is called the anterolateral surface, usually articulates with the two coxal bone or the two pelvic bone, right? Forming the pelvic inlet. That is how it works. So this is the anterolateral surface. This is the anterolateral surface, which articulates with the two placed right and left coxal bone or the pelvic bone. Now, watch this anterior surface. The anterior surface, I've said earlier that it can be called the pelvic surface because it faces the pelvic bone, right? It faces the pelvic bone, thereby creating or participates in creation of the pelvic inlet because it forms the posterior aspect of the pelvic bone. It also participates in formation of the pelvic inlet, which I've said earlier. Now, the anterior surface, which can be called the pelvic surface, is concave. You can see it is concave. It is as if it's depressed. It's not flat. It is concave, right? It has a depressed surface. And it presents an anterior sacral foramina. Look at it here. An anterior sacral foramina. This anterior surface usually provides site of attachment of the pelvic ligament and muscles, and it has a transverse ridge or a transverse line where that indicates the fusion of the 5 sacral vertebrae, right? Now, extending superiorly is a bony projection called the sacral promontory. This sacral promontory is an important bony projection because it forms the posterior margin of the pelvic inlet. It also forms the margin because after it forms the posterior margin of the pelvic inlet, it continues to form the margin of the ala of the sacrum. It also forms the margin of the pecten pubis and pubic crest of the pubic bone, right? It also forms the arcuate line of the ilium bone, right? So those are what the anatomical landmark of the bony promontory, that is the sacral promontory, which is here, is talking about, right? Now, let's quickly discuss the dorsal surface. You can see that the dorsal surface is a kind of rough. So it is coarse and rugged, right? Because of the fusion of the 5 vertebral bone, that is the fusion of the 5 sacral vertebra, thereby forming a bony crest or a bony ridge. That is why it is rough on this manner. You can see it is not smooth, unlike the anterior surface that is concave, whereas this is coarse and rugged. Now you have to understand that it is the fusion of the 5 sacral vertebra that made the sacrum to be inverted triangular bony structure. You can see it is inverted, right? Because actually this is how a triangle is, but here it is inverted. So it is the fusion of the 5 sacral bony vertebra that made the sacrum to be inverted triangular bony structure. Now let's look deeply on the posterior surface. Now before we dive into the posterior surface, you have to understand that internally there is a central canal. This central canal usually extends towards the 4th sacral foramina. The 4th sacral foramina, look at it. This is the 1st, 2nd, 3rd, and 4th. So when it extends to the 4th sacral foramina, it ends and become the sacral hiatus, right? At first, it was the central canal or the sacral foramina. But when it gets to this 4th sacral foramina, right, it becomes the sacral hiatus. At first, it was central canal of the vertebral column. But when it gets to this 4th sacral foramina, that is, it becomes the sacral hiatus. That is an important notification to know about. Now, the median or the central part of this posterior surface bears a bony ridge, right? It bears a bony ridge, which is called the median sacral crest or the central sacral crest. This central sacral crest is formed by the fusion of the spinous process of each of the fused 5 sacral vertebrae. You can see it here. Look at it. This is the central sacral crest or the median sacral crest, which is being formed by the spinous process of each of those fused sacral vertebra. It provides site of attachment of the supraspinous ligament of the pelvis, right? So that is how it works. Now, extending a little bit from the sacral crest is another crest called the intermediate crest. Look, this is the intermediate crest here. This is the intermediate crest, right, which is found on the middle. This is the intermediate crest. This intermediate crest is formed as a result of the fusion of the sacral articulating process. This is formed as a result of the fusion of the 5 sacral articulating process. Now watch. This is the lumbar vertebra. This is the lumbar vertebra. You can see that this is the inferior articulating facet of the lumbar vertebra, which articulates with this sacral articulating facet, right? So this is the sacral articulating process. Now, and it is found in the middle. So the fusion of those 5 sacral vertebra with their articulating process forms the intermediate sacral crest. Look at it on this manner, right? This intermediate crest, which is being formed by the fusion of the sacral articulating process, provides site of attachment of the ligament of the pelvis. And that ligament is called posterior sacroiliac ligament. It attaches on this intermediate sacral crest, right? Recall that this foramen is called the posterior sacral foramen. This is the posterior sacral foramen. Right here is the anterior sacral foramen because it's found on the anterior surface. Why this is the posterior sacral foramen because it's found on the posterior surface. Now, the next is the lateral sacral crest. This lateral sacral crest is formed. Look at the lateral sacral crest here. Look at it. It's the most lateral. This lateral sacral crest, you can see it. This is the central sacral crest or the medial sacral crest. This is the intermediate sacral crest. Why this is the lateral sacral crest? This lateral sacral crest is formed by the fusion of the transverse process of the five-fused sacral vertebra. That is how it works. And it provides site of attachment of the sacrotuberous ligament of the pelvis. It also provides site of attachment of the posterior sacroiliac ligament, right? Because I told you guys previously that the anterior and posterior surface of the sacrum provides site of attachment of the pelvic ligament and also muscles, right? So that is all about this posterior surface, right? Recall that I say that this is the sacral hiatus. This is the central canal of the vertebral column. Once it gets to the fourth sacral foramen, right, or the fourth posterior sacral foramen, it becomes the sacral hiatus, right? That means here is the central canal. This is the sacral hiatus. Let's discuss the clinical correlation. The clinical correlation of this bone is important in sexual dimorphism of the pelvic, right? Because this bone participates in formation of the pelvic inlet. And the pelvic diameters or the inlet in male and female is quite different. In female, the pelvic inlet is oval in shape, right? Because it is wider and broad. While in male, it is heart-shaped. It is smaller, right? And this bony projection, which is the sacral promontory, in female, it is less prominent in order to form a good pelvic inlet, which is oval in shape. Whereas in male, it is more prominent because the pelvic inlet in male is not oval in shape, it is heart shape. That means it is smaller, right? And that is why the pelvic diameters in female is wider and broader compared to the one for male. So that is to say that in female, we have more pelvic inlet, wider and broader pelvic inlet compared to male. So then another clinical correlation is the traumatic injury to the pelvic bone as a result of an accident or any other occurrence. Because when there's a traumatic injury, it will lead to the fracture of the pelvic bone, which will affect the joint that joins the ilium of the pelvic bone alongside with the sacrum, right? So that is how it works. Thanks so much for staying to the end of this video. I really appreciate it.